Hello, everyone, and good morning. Thank you for being with us. My name is Ann Sunderland. I am a Senior Communications Officer at the California Healthcare Foundation. And for those of you who are not familiar with CHCF, we are an independent nonprofit philanthropy dedicated to making the healthcare system work better, especially for Californians with low incomes. So we have a particular focus on strengthening the Medi-Cal program. And we recognize these recent expansions of Medi-Cal, regardless of immigration status, first to those 50 and over, and now to starting in 2024 to remaining working age adults. These expansions are absolutely historic step forwards in the state's journey to achieve universal coverage. And we know to make the most of these policies, our communications and our outreach to newly eligible Californians really has to be strong. So this past summer, CHCF funded Vision, Strategy, and Insights to do a series of focus groups with newly eligible Californians, 50 plus in Los Angeles. This project was developed with my CHCF colleague, Ilda Martinez, who's going to come on a little later, and with the counsel of a group of community-based organizations in Southern California. And what we really wanted to understand is what information, what messages were really most important to motivate folks to take action to enroll. So we're really excited to be able to share those results of that research with you today, and we certainly hope it can be informative in your own work. So our agenda is Michelle Cordova, founding director of VSI, is going to present the research results with support from her team, which includes Anna Fernandez and Thomas Seng. Then Ilda Martinez from CHCF will come on and moderate a Q&A session. And finally, I'll go ahead and plant the seed in everyone's mind now. We really hope this is just the start of a longer conversation. We really want to hear from you all about what other types of projects, what other types of messaging research could be useful to your organization going forward, especially as you start to plan for the 2024 Medi-Cal expansion. So Ilda's going to wrap up with some ways that you can provide us with that feedback and stay in touch. So before we start, just a couple housekeeping things. This webinar is being recorded. You will get a follow-up email with the recording and with access to the slides. And for the Q&A, please go ahead and drop your question in the Q&A feature, not the chat. So with that, I am going to hand it over to Michelle.
Thanks, Anne. Hello, everyone. I'm going to share my screen so you can see the presentation. We'll start with a little bit of background, although Anne gave you some, but after the May 2022 expansion to undocumented residents over the age of 50 for Medi-Cal, there wasn't a whole lot of message research about the expansion and about these target groups. And so CHCF commissioned this research. What we were trying to do was identify how aware people in the target group were in the expansion, how interested they were in it, and to identify any barriers to enrollment. We've done some work in the past and with Medi-Cal, with various groups, and we wanted to kind of calibrate that. Are we having the same barriers? Are there different barriers, new barriers? And to test some of the written materials that were already out there for comprehension, relevance, and motivation to enroll. This was not a traditional ad test. What we were looking for are, what are the key elements that we need to include in communications that are going to educate and motivate and address those some of the barriers that we identified in the research. So we conducted 12 focus groups among undocumented Latino, Chinese, and Korean adults 50 plus. These were conducted via Zoom. And we our kind of respondent base were adults representing the top 3 racial and ethnic groups among the eligible population. It certainly wasn't an exhaustive group. We'll talk about that a little bit later, but certainly the top three: age 50 plus, income consistent with eligibility, undocumented, LA County residents. And then we had some that had no past connection to Medi-Cal, some with some past experience with Medi-Cal through family members. And then we had two groups of the Latino respondents were members of My Health LA, but they had not been automatically enrolled in full scope Medi-Cal. So the groups were conducted by bilingual, bicultural moderators in language. And I want to talk just a little bit about the limitations of qualitative research here. Qualitative research, quantitative is like the numbers research, and qualitative is the touchy-feely one, right? That's what, we refer to it as, kind of getting really deep into how people feel about something. But because we're talking to fewer people, and because we're not talking to a representative sample of people, it's really better as a directional tool. So, across 12 groups, certain themes tend to emerge. And so we're able to draw some conclusions based on those themes, but they're not absolute, they're not projectable. And so we take this kind of research, for all its benefits, but also its limitations. And we also, as I mentioned, we only included Latino, Korean, and Chinese adults. So, and adults over 50. So we want to make sure that we don't, that we keep that in mind, and don't assume that these findings apply to other populations exactly or even at all. Okay. So when we first started, we started out the groups by asking people kind of, how do you feel, or how aware are you of like this new expansion, right? Have you heard about it? What have you heard? So about half of the people that we spoke to had heard of the Latino groups, had heard something about the expansion. And most of them really liked the idea of it, right? So the things they were able to recall is, oh, I heard something that it was for people 50 plus, it was for undocumented people. Those who were a part of My Health LA tended to be more informed overall, because they had heard from the clinics that they frequent, and they have really good relationships with the people in these, where they go to the clinics. And so they had heard it through that. Others had heard through friends or family members. They had seen it on the news, or they had received something in the mail from Medi-Cal. But across the board among the Latino respondents, there were some concerns. Like when they heard it, they're like, oh yes, I heard about it, but there was concerns over public charge issues. And there were questions about the requirements. So, does it apply to me? What are the requirements? What do I have to show? All of those things. Those were kind of initial questions. Among the Chinese and Korean groups, the awareness was lower overall, but it was also very well received when we first started talking about it. There was a pronounced hesitancy and uncertainty among these respondents about public charge and affecting their future immigration status. And some of the Korean and Chinese respondents were concerned about, whether this policy, this expansion was real, like was long term, or if it was something that could be taken away or changed if some new administration or new politician came on board. And then we asked several times during the group about their motivation to enroll. So we tried to kind of check in with them after we exposed them to some information. And we asked them, how motivated are you just with this basic understanding? Many people said, they were 4 to 5, right? They were very interested, but most of the people who were aware of the expansion already had not taken any steps toward enrollment at all. So they said, oh yes, we're very motivated, but we said, well, why haven't you gone and done something about it, right? Why haven't you, gone toward enrollment? And most of the people told us, most of the respondents told us that they would need more information, right? So that they needed to know more about the program before they would be comfortable or feel that they have the tools to enroll. So then we presented them with a description of just a very brief description of the program. And you'll see here, we've highlighted the things that caught their attention and why, right? So the new law certainly gave particularly the API respondents the feeling that this was credible. It was a law. It wasn't, as subject to the whims of administrations as it might be if it wasn't. The law was the word that really attracted them. The single most compelling phrase was immigration status does not matter. It was spelled out right there. It was clear. It was upfront, and it let people know that they were eligible immediately. People also recognize the 50 years of age. I mean, the free or low cost. These were all things that that called out to respondents that this was for them, and that it was beneficial. The particular programmatic descriptions were also very motivating. So when we called out that it covered dental care and vision care and referrals to specialists, these were very appealing. It was the specifics and the details about the program itself that tended to call the most attention. So they were very positive about the about the description. They were very enthusiastic about it, but they they felt that they would meet the criteria for age and for immigration status. And some of them said, well, yes, I think I would qualify based on income, but they still wanted to see more details about the requirements. So what they saw as benefits to them across groups, and this was something that was true among most of the respondents, was that these vital healthcare services that they had either not been able to access, or they would have to pay a lot of money to access, would become more easily accessible and affordable. And this is something that, as they were getting older, I think, a lot of them expressed it in earlier years, they just didn't do things, they just didn't have medical care. But as they were getting older, they had a greater need for it, and appreciated that. Chinese and Korean respondents are very appreciative that the state of California would, provide this opportunity. And we had one Latino respondent said that he felt that the state was recognizing that the contribution of immigrants like himself to the economy, and was helping them when they needed it. And then the fact that it was full coverage, a lot of people really immediately understood the difference between the emergency Medi-Cal and full coverage, gave them a lot of peace of mind about being able to access the services that they need without, and that they had been putting off, without worrying about their status or not having enough money to pay for it. So despite the fact that these, that the description and talking about the features and benefits and eligibility, was helpful in that way and communicated a lot of things, there were some things that it did not communicate, or the respondents had questions. There was some uncertainty about whether they met the income threshold. So when they were provided with, specific example, well, if you have 4 people in your family and you have this income, you qualify. Some were still confused about how many people in the family you qualify and whose income you need to use, and there were questions about income eligibility. Free or low cost was seen by some as being too ambiguous. They wanted really specific details about what products and services were covered. That new law gave Chinese and Korean respondents a lot more certainty about the credibility, but they still wondered about the susceptibility of the law to change. And there were also strong fears of public charge across groups that really wasn't addressed at all in the description. So we showed each group a combination of 4 ads in their native language. 2 were short form, and 2 were long form, like a flyer. So one kind of was like a social media post, and one was a flyer. And we rotated different ads, and we rotated the way that they saw the ads to avoid bias, but trying to get some information about what, again, not a traditional ad test, but what does this ad say to you? What questions does it answer? What questions does it raise? And what more information do you need? What's too much? All of those questions. So if you focus on the HCA on the bottom right, that's the one that actually had what was best received overall. And so we're going to be talking about that one. I'm going to go through some of the other points of the other pieces, but just very briefly. So the HCA was performed best across the board among all respondents. And even though it was like long and loaded with information, they called it detailed and comprehensive. So overall, the short form ads did not perform as well because they just gave a little bit of information. Everyone called the long form ads more complete. And they said that completeness, that the giving of information, the spelling things out inspired trust. The Q&A format of this HCA ad was easy to understand, easy to follow, and the questions that it featured were questions that they had. So then the answers came and made them feel really good about it. It highlighted their greatest concern, which is immigration status. It talked about regardless of immigration status. It talked about undocumented. It asks the question directly, will Medi-Cal harm my immigration status? And it was clearly answered. It mentioned getting help in your native language. And that really addressed a lot of concerns about not being able to ask the questions that they needed in the language they needed to ask them. And it listed the multiple benefits of full scope Medi-Cal. So dental and vision care, annual checkups, preventative health care. Those were really important features, and again, inspired it was not only informational, but it was inspirational. It made them feel like they could have confidence and trust in the program. And it included both a website and a phone number. And a lot of these older respondents told us that they were less comfortable online. They preferred to speak to a live person, and that having both of those options was really great. Some of the things that they didn't like about the piece, and some said there was a lot of copy. They weren't sure if they were going to read it all. They would have to get someone to help them. But on balance, they said they preferred the more detailed information over not enough information. There weren't very many people who were aware of the possibility that, about the property issue, which was brought up in the ad, in the flyer. So that issue raised more questions than it offered answers. And they felt that the answer to that question was very vague. And so that kind of threw a lot of people off. And then there was a lot of information about what happens after you turn 50. If you turn 50 after May 1st, that these groups took place after May 1st. So they really felt that was very superfluous. Again, in the interest of time, I'm going to go through a few of the other ones, but just pull out some of the highlights. There was another long form ad, a flyer that said good news on it, and people really liked the visuals of it. There was an image of a doctor, and so they felt that was really that immediately conveyed, healthcare. We're talking about healthcare. The headline called out 50 and older, called out immigration status does not matter. So that kind of immediately told them, yes, we are, this is for us. And the definition of full scope Medi-Cal with all of the services they could access, as well as them being free, was very helpful to them. What was confusing was that the flyer was sponsored by Bila Network, and they presumed that that was a CBO, but they were confused between that and full scope Medi-Cal, which everyone understood to be a government program. So they were like, who's sponsoring this? Who's in charge? Is this really a state? Is this really a Medi-Cal program? There was 2 websites and a bunch of numbers, and they felt that that was a little bit overwhelming. And then we showed this in the Chinese and Korean groups, and so the term white card in Chinese, but not the use of Medi-Cal, was a little bit confusing to people, or concerning, because they, it brought up kind of their public charge issues, and they wanted to see both white card and Medi-Cal used in the communications. We showed Latino respondents a Health for All communications piece, and they liked this one as well. They felt it to be complete, step by step. Again, there was an image here of a woman and her family. They interpreted this woman asking, her younger daughter, it was an adult woman, but that they perceived her to be the daughter, and asking her for help, which was very calming and reassuring. They called out the qualification that you live in California, and they felt certain that they would qualify for that, and multiple ways to apply: phone, web, and in person. But again, the Health for All, many were not familiar with that and confused about the relationship between that CBO and Medi-Cal. And so, we would, if there were a sponsoring organization, it would need to be made clear that this is a Medi-Cal program. The Latino respondents who were My Health LA members were shown an ad, a long form ad that was specifically targeted to My Health LA members. They liked it, that clear mentions of the full scope, the images of doctors and social workers. It mentioned you could go to a clinic to get more information, which was very relevant and very resonant, because that's kind of how they live their life anyway, and the inclusion of a phone number and a website. But they did, get a little bit confused about the, bringing up of My Health LA not being insurance and Medi-Cal is insurance, and they wanted the communication to really just specifically focus on full scope Medi-Cal and to provide information about that. And then the short form ads were shorter. They had like one piece of information, and so they were overall not preferred as well as the longer term ads. But what people did like was like the visual attractiveness of it. They brought up that the California.gov website, this is a made up ad, by the way, but the California.gov website was very reassuring. It was immediately credible and legitimate that the communication was coming from the state of California, and that they, a lot of respondents, which we've seen in other work, say that visiting a .gov website is even more credible than a .org. And then the other short form ad really did not have a lot of information. It didn't talk about immigration status, and it asked you to contact your local DHCS office, and many people were not sure that they could do that. They wanted to have a phone number and a website to be able to go to. So basically, the information that we, kind of looking at all of the things that were provided, none of them gave them exactly everything that they wanted, but very, several key important elements emerge, right? That need to be included in an effective and motivating piece. So that it's a new change in law, that the communication piece detail the range of health services covered, that it clearly addressed the public charge concerns, and that we make sure that respondents understand that the origin of the program is the state of California, and that it's a law that's not subject to, to change. And so the things in the ads, within the ads, the elements that inspired the most trust and the most motivation across all the pieces were a phone number, a toll-free number, the .gov website, symbols of the state of California, either a map of California, the seal of California, again, reinforcing that, how important it is that it's coming from the state, the address of a county office or a local CBO to visit in person, and clearly mentioning full scope Medi-Cal. Some elements that none of the materials had that respondents noted that they would like to see were illustrating steps, like the next steps more graphically, and maybe testimonials. Some people brought up like testimonials of people like them who'd been through the process and were actually enjoying the benefits. That would give them more trust in the process. And so then again, we asked them after exposure to these ads, how motivated they were. And most people, who said they were somewhat motivated, all said very motivated by the end. But when we asked them, this time, well, what are you going to do? Like, you're so motivated, everyone is a 5. The first time we asked them, they said, well, we're not sure what to do. When we asked them again, after being exposed to these images, to these flyers, they said, well, they were going to call, they were going to go in person, they were going to get information on how to apply. So what the information gave them was kind of like a roadmap to what the next steps would be, and a concrete thing to do. And it assuaged a lot of the fears that they had in the beginning. We asked them basically to wrap up the information about these ads or these flyers, these communications, where they would want to get information. They talked about, the Latino respondents talked about Spanish TV, radio, mailers, but then also places in their daily life like clinics and supermarkets. A lot of people said TV because that's the first thing that they say, but they also acknowledge, that's not enough time to tell us what we need to know. So they were very willing to read a flyer because they had so many informational needs. Chinese and Korean respondents also talked about TV, radio, and newspapers. They also noted clinics, doctors' offices, supermarkets, but they, in addition, talked about health fairs and churches, in the Korean groups in particular. A lot of them were not on social media, but they also talked a lot about how their kids helped them with technology. Like a lot of their kids helped them get on our Zoom to have the focus groups to begin with. We met a lot of their kids during that process. And so, targeting, their children, and then later on, talking about the full expansion, social media would work for that age group. And we asked about credible messengers, and they talked about, messengers, representatives from the state, the representatives of the Department of Health, leaders in the Medi-Cal program. And again, some people talked a little bit about testimonials. For Chinese language respondents in particular, there were some, translation or, the way that we called Medi-Cal, full scope Medi-Cal or Medi-Cal across all the concepts, that some of them were different. And so there were preferences for certain translations, and only some of the Chinese respondents were familiar with the term Medi-Cal, because they tend to call it white card. So they wanted to include both the Chinese symbols and the word Medi-Cal, and then just followed by Medi-Cal, so that they understood what people were talking about. And then finally, this is the key takeaways that we came away with when we, after kind of getting all the input, was that more information is better, that the more detailed information that we can provide addresses concerns and encourages, answers questions and encourages people to feel that they can trust what they're reading. The more answers to questions they get, the more concrete their motivation becomes. The second point, emphasize the connection to the California government. This was very important. I know we've, talked to a lot of different organizations who, have said, well, we're concerned that, this is an immigrant population, it's an undocumented population, they don't have trust in the government. But to be honest, the government, they have more trust in the government than a lot of other organizations, because they know it's reliable, right? That it's official, that they aren't going to be cheated or told something wrong, and when they get the information directly from the government. So people want to know that it's a new law, that it's a government, that Medi-Cal is a government program, which most people recognize. Include a .gov website wherever possible, and use government officials or Medi-Cal representatives as credible messengers. And then the third point, we need to address worries about immigration status and public charge head on. We want to display it prominently and say it explicitly. That's the number one question in their mind. So we need to provide that answer before we can move forward with any of the other barriers, right? And providing multiple contact points, including phone and in-person options, so that people, especially these older folks that are not comfortable with just a website, they like the fact that there is a website, but they like to have additional options, so they can either talk to a live person, or they can go in and talk to a person and feel like they can get their particular questions answered. And that is it. So I'm a few minutes early for the Q&A.
Thank you, Michelle. Hello, everyone. My name is Hilda Martinez, and I am a Senior Communications Officer at the California Healthcare Foundation. I will be facilitating today's Q&A discussion. Our first question today, and we have many, is, did the respondents themselves raise public charge, or was that term/topic prompted by the questions? It's a two-parter. Or did the respondents refer to it as immigration concerns, worries, or something else?
So overall, they raised it themselves, and they said they didn't refer to it specifically as public charge. Most of the time, they talked about it as, I'm worried it's going to affect my immigration status, or I'm worried that it's going to affect my future, my either in the present or in the future, my future opportunity. Thomas, if you want to talk a little bit about what they talked about in the Asian groups, but generally in the Latino groups, it was talking specifically about concerns about just my status and how it might affect my status.
I would say it was also very similar for the Chinese and Korean groups as well. It's just the impact on their tenuous legality here, and that there are concerns about what kind of impact or implications that might have for them since they were undocumented. So I think very similar to what you just described, Michelle.
Thank you, Michelle and Thomas. Our second question, were there similar rates of experience with emergency Medi-Cal across the various language groups?
So no, I mean, some people, we had kind of deliberately mixed the groups, whether people had experience either themselves with emergency Medi-Cal, or someone else in their family had Medi-Cal in some way. But no, I wouldn't say that, I mean, again, it's not quantitative, so we didn't really count, nor would it be representative, but those who have experience with emergency Medi-Cal were very clear about the difference between that and full scope.
Great, thank you, Michelle. For the HCA Flyer Feedback, in quotes, "No, Medi-Cal will not take you home," is the bottom line. Did any respondents have this concern or fear before seeing the flyer?
I'm sorry, go ahead. Can you repeat the beginning of that question?
Sure. So they're referring to the HCA flyer and the feedback that we received. And in particular, they have in quotes, "No, Medi-Cal will not take you home." Did any respondent have this concern or fear before seeing the flyer?
No. That was the concern of the flyer, was it raised an anxiety or a question or a fear that they did not have before. I think one or two said that they had heard something about it in response to it being raised, but no, it did not come up until they saw it on the flyer.
Thank you. For the short form pieces for social media, for example, like some of the, I guess there were some short form referring to DHCS materials. What's the best way to include or refer to needed key information in these pieces, understanding that family members might be relaying the info to elders?
Yeah, I think what was missing in the short form across the board was that, the piece of the piece about undocumented people, like the status piece. So a lot of it was like Medi-Cal for 50 plus. One of the pieces said your status doesn't matter, but it needs to be just a little more explicit than that. And then, to have a phone number, to have a website, to have something specific to go for more information. I think that's what they mostly told us.
Thank you, Michelle. Some more questions coming in here. This question was repeated a couple of times from different attendees. Were there additional sample groups on other racial, ethnic, immigrant populations? Could you address why we chose these populations to include in our focus group?
Yes, no, we did not. Those were the three that we did. We chose those three groups because they are the largest groups. That is not to say that they are representative, and we have so many groups in California. And it would certainly be worth, conducting this type of research with, other groups. It just, it was not within the scope of this project, but not that it's not a good idea to do. But we prioritize these three groups because of their representation of the population.
Thank you. Another question that we have is, based on respondents' input, how might we balance trust in government with the phrase, "Few were familiar with DHCS, although many guessed it could be a state agency"?
Yeah, I think for that one, it's just spelling out, we use a lot of acronyms, right, in English, and it's a little bit hard for people to recognize at first. So, if you spelled out the name of the organization, it might help, to identify it, or if the organization had a .gov website, or even a .ca, then that might kind of relay that information without having, without taking up a lot of space on a page.
Thank
If
you.
I may jump in here too, like Michelle previously said, making it more official, they seem to really trust the California government. So making it more official, somehow using the California state logo or something like that might be an easy way to do it without having to explain completely what it is.
Or the county seal, for example, right? So that people brought that up on their own. A map of California or a county seal or something that would tell them that this is official. This is an icon that represents California.
Great, thank you. Based on your findings that emphasizing the connection to the California government is helpful, is it safe to say that consumers would want to see co-branded materials between CBOs/orgs and DHCS?
Yes, I would say so. I just think that one thing that we did find was that if the relationship, if that code branding wasn't explicit and explained, then sometimes people got confused. Like Medi-Cal would have to be super prominent, right? And that maybe the CBO would have to be the place you go for information. Or something that explained the role of the CBO or indicated the role of the CBO, because otherwise it tended to be a little confusing if they didn't know the organization, if they weren't familiar with the organization.
I would also add that for the Chinese and the Korean side, that might tend to confuse a lot of the respondents as well. I mean, because I think what they will gravitate towards is the government or the .gov. But then if they see multiple contact points, including like multiple, and I think one of the ads, I'm not sure whether it was the Good News or the Health for All, had a couple different emails and phone numbers. And I think that tended to be more convoluted and confusing for a lot of folks. So I think part of that is also making sure that there's a streamlined way of contact that tells them that this is an official designation for the program. So.
Thank you, Thomas. I'm going to answer this question myself because it keeps coming up. It's come up multiple times throughout the webinar. Will the findings be written up in a report? If not, would you be able to circulate the slides? So I would like to let everyone know that we will be having a follow-up email go out with the presentation and a link to the webinar. And all of the materials, including the presentation and the recording of the webinar, will also be available next week on the CHCF website. Next question. Looking at next steps, do you have any idea how to communicate the messages to the greater California population, including rural areas? And I'd like to chime in here just for a bit. If this is an area that, and this question came from Christy. If this is an area where you'd like to see more research, I would encourage you to please put that into the Q&A section, or to fill out the survey at the end of the webinar. We'll have a question there asking for your feedback on what additional research you'd like to see. I'm not sure if this is something you want to take up right now, Michelle, if you're able to answer this.
Yeah. I mean, that's a little bit beyond the scope of what we do, but we are happy to do additional work. We believe that additional work could be done among other subgroups. I can just say that the beauty of Zoom interviewing allows us to speak to rural respondents that we never got to speak to before the pandemic, or rarely got to speak to. And so it just takes away another barrier for us to speak to people that may not be may not be spoken to as much as they should.
Great, thank you. I'm just scrolling through a few more questions. Michelle, is there anything in the research that was surprising to you or that was new? Maybe it's some new information that we really hadn't thought about before that might be revealing to the participants in the panel?
I mean, I think that the level to which people think something is a good idea and then don't act on it is very surprising. I can't say it's new because we see this quite a bit. We have an expression in Spanish, entre dicho y hecho hay un gran trecho, right? Like between liking a thing and thinking a thing is good for you and then doing that thing, there's a lot of ground to cover in between. And so, the more that we can make that smaller by providing information that people really need, because it's counterintuitive that this is such a great program. Why wouldn't people, even when they have a description of it, and when someone's telling them it's great for you, why wouldn't they do it? And so I think we learned a lot about how to get them there, how to kind of hold hands with them and take them across that, that gulf. So surprising, but not new.
I'll mention something that really surprised me as well, which is the fact that typically when we do evaluations of copy and advertising and messages, people want things distilled to the simplest, the most efficient way possible, meaning the less copy, the better, the more that you can economize the amount of wording that you use, the better, because simply just people don't have the attention spans for it. In this case, as I think Michelle's gone through and what we've seen in this research, is that the HCA ad, which was the most copy intensive, that had the most information, was actually the one that really was the most compelling to people. And I think that speaks to how important and how attentive people are to this particular topic at hand and how pertinent it is to them and how important it is to them. So they want more information. And I think that is really telling about what this means to people, to the point that, I think in any advertising, good advertising will, content will beget more questions. In this case, they want things to be comprehensive and straightforward up front, and they still have further questions after that. And again, I think that speaks to the importance of the topic for these folks that we're speaking to. So.
Thank you. Another question. So, it's interesting that the participants in the focus group wanted to see that the information was coming from a government agency. Can you articulate or tell us a little bit more about how we can reconcile that with fears of government that we've observed, heard about, seen in the past that immigrants have toward the government?
Yes, I think it helps to think about the experiences that they have on a daily basis. They're a vulnerable population, so they tend to be exposed to a lot of groups or individuals that would do them harm. And so, I think we talked about, being a little bit like the lesser of two evils. But with the government, I mean, they've had a lot of experience in California with government services, right, over the years. I mean, they've, been able to get driver's licenses, and they've been able to access certain aid programs. So I think there's the overriding fear, but there's also this kind of over the years understanding that the government can be a resource, but that extra piece that is that the government's probably not going to lie to you or trick you, is, or if anyone's going to lie to you or trick you, they'd be the least likely to do that. I think that's what kind of inspires the trust, is that if it's coming, I mean, I think we did some public charge work a couple of years ago, and we had people who were looking on INF's website and talk, undocumented people, because they wanted to get the most accurate information, right? So yes, they're in a precarious situation, but it's better to get accurate information from a difficult, source than it is to get inaccurate information from a source that you may, feel more comfortable accessing.
I also think that because it is California, and they feel a little bit more protected, very few mentioned that they would be afraid that they would be, persecuted, that they would be, chased or do harm. And even when a couple of people mentioned that they would be afraid to look into it because, of maybe ICE coming after them, the others said, oh no, but they wouldn't do that because they don't work together. So they're aware. I think it would be different if we were in another state like Texas or Arizona, right? But I think in California, they feel pretty safe trusting the state government.
Thank you, Anna. I appreciate that. So I just want to acknowledge that there are a number of questions that are coming in that fall outside the scope of this webinar, asking for specific information about public charge, Medi-Cal estate recovery, topics like that. So we'll do our best after this to point you to resources where you might be able to get that information, but unfortunately, we're not able to answer those questions within the scope of this webinar. But just wanted to acknowledge that. It does appear that there's a hunger for information, and so we'll do our best to provide resources. So thank you. Before we sign off, we have just 1 minute left. Michelle, Thomas, Anna, is there anything that you'd like to leave us with before we move on to the next portion of the webinar?
No, I think, I would encourage people to ask as many questions as possible, and any more detailed information that we can provide. The part we love best about doing this work is having you all take the information and craft the communications that are going to help these communities get what they need. So we're here to answer any questions after this webinar as well, and provide any additional information that you might.
Thank you. Wonderful. Well, thank you all again very much for the presentation and for the answers to all of these questions. We look forward to hearing from you. Again, your feedback is really important and will guide our research going forward. So as we near the end of the webinar, I just want to thank Michelle Cordoba and her teammates of Vision Strategy and Insights for their presentation today. We ask that you please take a moment to fill out the survey at the end of the webinar. It helps us tremendously in planning future webinars. Thank you again for joining us today. We hope that you found this webinar informative. This concludes our webinar. Have a great rest of your day.